If I had $1 for every time a patient told me they didn't want to have dental x-rays. Hello again, everyone, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. Okay, all kidding aside, in today's short video, I want to discuss the subject of dental x-rays, why they are so important to your dentist, are they safe, and what your dentist's office does to protect you. Let's start by addressing the elephant in the room first, because the last thing I want to do is insult anyone's intelligence. Yes, dental x-rays are radiation. Yes, too much radiation is not good for you. Yes, every precaution should be taken to reduce your exposure to this radiation. And yes, your dentist takes all of these concerns very seriously. So even with all these concerns, why does your dentist want you to have these x-rays every year? Well, there's only so much information that can be gathered about your dental health by visual inspection only. Way more vital diagnostic information lies beneath the surface, if you will. Your dentist can't see the inside of your tooth, which would help us detect any cavities early on. We can't see the roots of your teeth, which would help us detect infections early on. And we can't see the health of your jawbones, which would help us detect any bone loss, cysts, or even oral cancers early on. Now, there are pieces of dental equipment out there that help detect cavities by the use of a laser or infrared light and not radiation. I had one, and it was very helpful, but there was only so much it could do. New ways of helping dentists diagnose patients without taking x-rays are in development currently, but none of them are ready for use. Perhaps in the future, we won't even be talking about dental x-rays anymore, but for now, we are. And oh, by the way, dental x-rays are not just another procedure that your dentist uses to charge you. They truly need this information to properly treat you and to provide the care we all took an oath to deliver. There were plenty of instances where I and many of my colleagues wouldn't charge a hesitant patient simply to take the cost factor out of the equation because we needed to know what we didn't know, and x-rays were and are our only solution. Okay, so hopefully you can see why your dentist needs to take dental x-rays, but are they safe? Excellent question. As I mentioned earlier, we're talking radiation here, and we'd all be better off without any radiation. But that's just not realistic. We're surrounded by it each and every day, from the sun and the atmosphere, to our smartphones and televisions, to flying around in an airplane, to playing a round of golf. It's all around us. But on the grand scale of the different types of radiations out there, something I will not bore you with, where do dental x-rays land? Way on down at the low end. Some studies have compared the levels of radiation in dental x-rays as equal to the amount of background radiation one gets from living here on Earth for 10 days. Other studies say it's equivalent to spending 2 hours in the sun. By comparison, mammograms are 70 times the radiation of dental x-rays, and a chest x-ray is 700 times the radiation. Okay, Doc, you keep telling me that x-rays are safe, so why does everyone run out of the room whenever I have my x-rays taken? Fair question. Keep in mind that radiation exposure is cumulative. You get more exposure being in the sun for 5 hours than you do for 1 hour. Your dental hygienists and dental assistants are taking x-rays on 8, 9, 10 patients a day, every day, and that would result in unsafe levels of exposure. Therefore, for their protection and to follow the law, they do leave the room. So in conclusion, let's try to limit our exposure to any radiation as much as possible, but yes, in my professional opinion, I consider dental x-rays to be necessary and safe. So what exactly is your dentist office doing to help keep your exposure levels low? Well, first of all, one of the most visually obvious ways is the use of the protective aprons and thyroid collars that you are probably so used to going back to your childhood. Back in the day, the older x-ray machines used to emit a starburst of radiation that filled the whole room. So in order to protect sensitive parts of our bodies, the use of aprons and collars were developed. These coverings block up to 95% of your radiation exposure. Second, Almost all dental offices today utilize digital X-ray machines. This technology not only reduces the amount of radiation needed to obtain an image by up to 80%, but it shortens the exposure time for you. In addition, these machines focus the radiation so precisely that that scatter radiation, the starburst I talked about, is eliminated. So the whole procedure itself is quick and non-invasive. And third, the Food and Drug Administration has safety guidelines for X-ray operation. The technology is regulated by both state and local authorities, and dentists must license their equipment and have it inspected annually to ensure that it is functioning properly. So there you have it, folks. Dental X-rays are to be taken seriously. They are necessary to your dentist. They are safe, and your dentist's office takes every precaution to maintain that safety. Well, folks, let's wrap up today's video. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.